We are starting our sessions, interactive head and neck sessions today this morning by talking about robotic surgery. Robotic surgery has had widespread applications since its introduction about 20 years prior. The original Da Vinci surgical systems were the first robots to find their way into clinical applicability and surgical practice. The Maryland bipolar. So what happens is that these instruments typically work on the direction of the surgeon and thereby make sure that we are able to do the surgery remotely. The advantage, of course, being that we can do the surgery with either hidden scars, smaller scars, or no scars at all. The advantage is because it's minimally invasive, we are able to do the surgery much more cleanly. You have a 3D stereoscopic view. So the surgeon comfort, of course, comes into the equation because instead of hunching over the patient, we are actually seated comfortably on a console. And the biggest advantage is that a robotic instrument has 7 degrees of freedom, which means that my wrist only has 3 degrees of freedom. But the robotic instrument, because it's connected on multiple joints, has 7 degrees. So not only can my hand not reach into these difficult to reach spaces, but also once my hand reaches, it can only reach particular areas. So these would be the rough advantages. So these are instrument arms. You can see over here, this is number 1, number 3 and number 2, and this is the camera arm. The camera provides this view. Remember, the view over here is 2-dimensional, but in the console it will be 3-dimensional. And the instruments that you're seeing currently, we can use only 2 instruments at a time, just like the pincer grasp of a surgeon. This part is known as the vision cart. The vision cart is a modifiable equipment which already has microphones mounted on it, which can help the staff listen to the instructions of the surgeon. It also has an illuminator, and this essentially is the core of the machine from this standpoint. So the assistant, after watching the surgery, because the surgeon is going to be on the surgeon console, the assistant is going to be here. The assistant watches the surgery and does various steps like a suction, like picking up instruments, picking up debris, picking up the specimen, cleaning the instrument tips, and that would typically be the domain of the assistant. Also, the vision cart is good for training purposes. So it can help you teach residents. The surgeon or the assistant surgeon can teach observers about what surgery is. I've seen that conceptual surgery relies a lot on writing, and this in its own way is a stylus that is able to do that over there. So now that you're familiar with the 2 components of the robot, we'll move on to the 3rd component of the robot. Please follow me. This is the surgeon console. This is where a surgeon sits. If you zoom over here, these are the camera controls. These are the cautery or the thermal controls. The surgeon console moves up and down based on the discretion of the surgeon. Come. Zoom over here, please. There are specific consoles here which already have my settings added to it. So in this case, once I add my settings, the surgeon console moves into the configuration that is comfortable for my body. Zoom out. Zoom in over here. Once the surgeon seats himself in this position, there are 2 pincer grasps here. Mere hands pe focus kijiye please, which are able to connect to this accordingly.